Good afternoon, everybody. This is Congressman Adriano Espaillat, representing the 13th Congressional District, which includes Harlem, East Harlem, Hamilton Heights, Washington Heights, Inwood, Marble Hill, and the Northwest Bronx. Welcome to this edition of Represent NYC with Manhattan Neighborhood Network. We're having an important discussion today. We will be discussing aspects of the COVID-19 pandemic. We'll also be discussing issues related to the immigrant community. With us, we'll have Assemblywoman Carmen de la Rosa from Northern Manhattan and Councilwoman Diana Ayala from East Harlem. So we want to welcome all of you to this discussion. As you know, the COVID-19 pandemic continues to rage across the country. In the last few days, we had really tremendous numbers, very high numbers of COVID-19 positive cases across the country. New York City and New York State were successful in controlling the pandemic, and we saw a dramatic drop, but we're also seeing slight increases in our city. So we must continue to engage in the practices that will lead to a reduction and a containment of the COVID-19 virus across the city of New York, particularly in communities that have high rates of diabetes, of high blood pressure, of respiratory and cardiovascular problems that obviously proved deadly during the March, April, or May months of the pandemic here in New York City, and hit hard many of our communities, including Northern Manhattan and East Harlem. For that, we have two great leaders, two women, one representing Washington Heights, Inwood, and Marble Hill, Assemblywoman Carmen de la Rosa, and of course, our great councilwoman from East Harlem, the Honorable Diana Ayala. So we want to start by asking Carmen to please give us her views on the COVID-19 pandemic and some of the best practices that were adopted in Northern Manhattan to address the crisis. And how does she see this moving forward? What must we do to stay safe and healthy? Carmen.
Thank you, Congressman, for the opportunity to join you today, and to MNN for having us. You know, the COVID-19 pandemic has especially hit communities of color, Latino communities, communities that have been vulnerable even before the pandemic hit. We know that there is systematic changes and vulnerabilities that have existed in our community. For example, housing is a major issue in our community. Congressman, you and I have talked a lot about how quarantining in small apartments in our communities, apartments that for many people have already had mold, lead, and other issues that we know are systematic across the housing stock that we have in Northern Manhattan. These systems have not allowed for our communities to heal or to be able to fully recover from COVID-19. Add on that the economic stressors that now exist in our community, a community that has had historic high unemployment rates, higher than the rest of Manhattan. We are now dealing with the economic stressors that COVID-19 has produced in our community. So it's been a tough moment, but what I have learned from our community, and I was actually on a panel last week with Columbia University, and we were talking about the resiliency that has always existed in our community. And in that resiliency, I find hope, and I find a path towards ensuring that our community can continue to recover from this pandemic. Our business owners are resilient. They bounce back. They are creative. If you walk down Dyckman Street or you walk down 181st, you've seen the type of outdoor dining experiences that they have created for our community. So although COVID-19 has taken, for example, in my district, there has been over 300 deaths. There has been over close to 4,000 positive cases throughout this pandemic. But we see that our community is not deterred, that they are determined to continue to strive towards rebuilding our community. So we have an opportunity, and I want to answer that no on a positive note, because now we have the opportunity to address those systematic problems that have always existed and blaze a path forward for our community where they will feel that they are heard, that they are seen, and that there are solutions on the table for them. Some of the best practices that I saw in Northern Manhattan include mutual aid, a lot of our nonprofit sector stepping up to ensure that there was food pantries operating every single day in our community. We also had great public-private partnerships with our restaurants who also provided food. Food insecurity has been a major issue in the community and continues to be. And in addition to that, we saw our local doctors, who I know, Congressman, you value, and you know the importance that they have done in our community as far as setting up testing sites. Before the city even responded, our local doctors did. And so I think those are some of the best practices. We're obviously learning every single day how to eradicate this virus. But I'm grateful to be in the position that I am and to represent this beautiful community.
Thank you, Assemblywoman. Now let's hear from the Councilwoman. I know that East Harlem has been hard hit. This morning I joined you in unveiling a great program for small businesses. We know that this pandemic has two aspects of it. The health aspect, and I know that you have been personally touched, Councilwoman, by this. And then, of course, the economic aspect. So I want you to touch on a little bit of both. First, the health aspect, and then if you can get the opportunity to please inform the general public of the great grant opportunity that you unveiled this morning on 116th Street. Councilwoman Diana.
Thank you. Thank you so much, Congressman, and thank you, MNN, for having us. It's nice to see you, Carmen. So yeah, East Harlem, you know, my district is a multi-borough district, so I represent East Harlem in the South Bronx. We're seeing some spikes in COVID in the Bronx part of the district, primarily in Highbridge. But in East Harlem, we remain pretty stable. And I think that really is, I attribute that to better access to testing sites. We were able to, in the beginning, to really make a case for why we needed to have more testing sites available in East Harlem. We tested, actually, zip code 10029 tested the highest positive in the beginning of the COVID pandemic in the entire borough of Manhattan, which was really telling. We have some of the poorest communities. We have an oversaturation of public housing in this community that really did not receive the services that they needed. I think that the education around how to keep yourself safe, how to keep your family safe was really not targeted to communities of color in the way that it should have been. There are a lot of cultural norms that I think kind of put us in the way of, made us a little bit more vulnerable to contracting COVID. Myself, you know, included. I live in a family, in a household of 7. And so it was very difficult to contain the spread of COVID once I got it and my husband got it and then my mother got it. And I'm sure that my children had it and were symptomatic. And so the ability to test has really been crucial. The access to PPE has really been crucial and has allowed us to keep the numbers in East Harlem stable. Having said that, I think that while we are seeing that people are getting back to normal to some degree, offices are starting to open, small businesses are really allowing themselves to benefit from open streets, that there is still a lot that we have to deal with, right? We have to deal with the uncertainties of, tenants that may be on the verge of displacement because they lost jobs and they still haven't been able to access the resources. Many undocumented families don't qualify for, state funding or city funding to help pay whatever rent, they're in arrears to. So that's something that we're kind of being mindful of. And then, of course, we're also dealing with the issue of access to technology for children in schools. So a lot of our children, go to schools that don't have the resources that they needed, to ensure that their virtual education was of good quality. And so there's a lot of concern that our children are really going to be significantly impacted by that. And then, third but not least, our small businesses, which are the backbones to our communities, really were devastated by the corona pandemic. This morning, we were able to unveil a $4 million grant opportunity to help small businesses, and I'm really proud of this. And thank you so much, Congressman, for your support and your leadership in this as well. Because again, I said it this morning and I meant it. This is a joint community effort that took all offices, and I really appreciate that. We were really fortunate in that, many years ago, we actually, community stakeholders fought for a community investment fund when Pathmark was constructed on 125th Street. And so that money kind of lingered for many years, and we were able to use it now that we needed it the most to create not only a $4 million grant program for small businesses, but there's also going to be a $4.2 million, a low interest revolving loan program for East Harlem businesses as well. And we were also able to keep what was a pilot program, a 3-year pilot program called the SBS 360 program, which is a program that works with all of the merchants along certain corridors, and it really acts kind of like a bid, if you will. So we're really excited about that. We still have a little bit under $2 million available. So if there are small businesses that, you know, still haven't had the opportunity to apply or they didn't know that the grant application was available, please feel free to do so. We try to make it so that the grant application process was simpler than the PPP, for which we know many of our small businesses just simply didn't qualify for. So, you know, if you didn't qualify for PPP, don't let that be a deterrent to applying for the community-based grant, because again, we specifically catered around the needs of the small businesses in the community.
Thank you, Councilwoman, and thank you for that great job of securing these dollars that were around for over 2 decades. And I think that they came at a timely time on when businesses really needed. I think that you did a tremendous job of making sure that you navigated with your business leaders, all the bureaucracy, the city bureaucracy, to access those dollars and to put them to good work. Now, both of you mentioned immigrants, and I want to know what's your take on immigrant communities? I know that immigrants have been through a rough time, not just because of the pandemic and the disproportionate hurt that they suffer during this pandemic months, but also in general. It's been a rough season for the immigrant community. The courts have really stepped in, but what are some of the challenges being faced by the immigrant community?
Sure. Absolutely right, Congressman. For the immigrant communities, it's been a difficult moment. You know, I like to say that, you know, the night I got elected, Trump got elected, and that's not a good thing, right? Since that day, we have been taking to the streets steadily to fight for immigrant communities, especially. We've seen the hurt and the pain that immigrants have gone through, not only with the deportations that have happened, the crisis on the border, more recently, as you have shown so much tremendous leadership on, what's been happening to women in detention centers, right? It's just been one attack after the other. One of the things that I've tried to focus on in the state legislature is creating a path forward for our undocumented immigrants and our non-traditional employed immigrants by posing legislation to tax billionaires in order to create a excluded workers fund, right? Our workers are essential. We have seen them on the front lines. They never once went home, from delivery people to support staff to janitorial staff at hospitals. Immigrant workers have been carrying our communities during this pandemic. And one of the things that was so heartbreaking was that at the height of this pandemic, as our office was helping thousands and thousands of people fill out their unemployment benefits, undocumented immigrants or non-traditionally employed immigrants had no access to any help. So we've created legislation and we are trying to create a mark-to-market tax to ensure that we are creating revenue in New York State that will go towards essential and excluded workers fund, kind of like unemployment, but for folks who do not have a traditional method of reporting their revenue, because what we've seen is that they've had to risk their lives more than should be necessary in order to put food on the table. They've been the ones who, as we saw in the epicenter of this crisis at Elmhurst Hospital in Queens, for example, lost their lives in tremendous numbers because of the risk that they were exposed to. And so we're trying to really bring to light the plight of excluded workers, and doing that by offering financial assistance. But in addition, if you think about immigrant children, that's another area that we've been looking at. You know, and the councilwoman alluded to this, the no access to broadband, the language barriers that have existed for our education system. You know, I was on a Zoom call last week with my daughter's school, and just thinking about how does a family member who doesn't speak any English, who doesn't have access to traditional means of technology, even help their child in this moment? It's been a very difficult process. And so we have to keep in mind as we go out to vote, that our vote doesn't only reflect what we want to see for ourselves in society, but that we have to be the keepers of those who do not have the privilege and the right to vote just yet, and make sure that we are engaged, because if not, we will not have the democracy that we need as a country in order to support immigrant communities.
Thank you, Assemblywoman. Councilwoman, can you share with us some of the initiatives that the City Council has been working on regarding immigrants' rights? I know that you're right on the ground and you have a very big immigrant community as well in your district.
We do. We have one of the largest, immigrant communities in the 8th district. I think, the shame in all of this is that I don't think that we're doing enough, right? Not only at the city council, but also, in the city. I think that the biggest champion of undocumented families throughout this pandemic have been charitable organizations that have been on the forefront of ensuring that food insecurity was not an issue, that that they were able to access private dollars that were able to help immigrant families really pay for rental assistance. Just in the Bronx part of the district alone, I mean, you can't step from one block to the other without seeing the long lines of families. And unfortunately, many of those families are, immigrant families that did not qualify for, federal funding, and they don't qualify for food stamps. And, and many of them, because of the public charge rule, did qualify at some point, and then they just disenrolled, right? Because they're so afraid of this administration coming after them that they would rather, starve or figure out other alternative means of feeding their families and having to rely on government assistance. And that's a shame. That's a shame because it's a failure of, our government. It's a failure of this democracy that, we are so proud of. So I think that there is definitely more that we can do. One of the things that we have done locally, however, is that because we understood that that was the case through the small business grant program, I made sure that we specifically set aside some funding for food vendors. Many of whom are, undocumented, because we know that they lost everything. So we made it so that they could also apply for these resources, because once the shut off hit, they couldn't, they couldn't even, leave their homes. So I'm hoping that those resources allow them some sort of a reprieve.
Certainly, we still need to continue to fight for the TTT, which is testing, tracing, and treatment. We see how the testing has been an important tool in really combating and suffocating the virus. Before even the economy fully opens up, we must attempt to suffocate the virus. And we could only do that by testing, right? And then tracing those that are positive, and then providing treatment, including prevention, right? For folks that should be washing their hands, using their masks, socially distancing. All the recommendations that were given back in March and April still hold true today. So we must continue to fight for additional funding for tracing and for testing, which I think are critical in this fight against the virus. Now, in the immigration front, I recently visited the Irwin Detention Center, ICE Detention Center, where women are being held, immigrant women are being held. And where we had a whistleblower really share with us some very concerning and horrendous practices there. Primarily that women are being treated harshly. They're exposed to very invasive treatment and procedures, medical procedures that have led to two of them getting a hysterectomy without proper notification and consent. And so this is a very serious matter. We visited the Irwin Detention Center in Georgia with a congressional delegation, and we spoke to the whistleblower and we spoke to some of the women who complain about the way they're being treated by Dr. Amin. Now, this is a detention center which is privately owned by a group called LaSalle. So we're very concerned. We're calling for the closure of the center and the immediate arrest of Dr. Amin. And we're calling for congressional hearings on this matter. We feel that they're really outrageous that women are being treated in this way. Many of them complain that they were very afraid that they would speak out and then they would wind up in solitary confinement at the center. Some of them, we were successful in getting them to be sent back home. Some of them felt that they wanted to go back home rather than continue to feel these harsh practices in the center that, by the way, also was very negligent in its treatment of COVID-19 within the center itself. So we will continue to fight for immigrants. We will continue to acknowledge that they also have rights, and that women in particular should not be subject to very invasive medical practice. They really didn't know what they were being treated for. Some of them didn't really know that they were about to or got a hysterectomy, and as such were sterilized for the rest of their life. This is outrageous stuff, and we will be pushing back very strongly against this. I want to hear now some parting words. I know that we're about to have a few more minutes, but I really wanted to hear some closing words from our Assemblywoman and our Councilwoman as well. Carmen, if you can please share with us your parting words.
Sure. Well, first of all, thank you, Congressman, for allowing us the opportunity and the platform to share our voices with the community. I want to emphasize that our office is open for services. Our office is located at 210 Sherman Avenue on the corner between 207 and 204. We do have limited capacity due to COVID regulations, so please call the office and make an appointment if you need assistance. The number is 212-544-2278. And other than that, I just want to thank our community for, as I said before, showing the resiliency and having the forethought of ensuring that we can continue to move forward and have the opportunity to reimagine what our communities will look like once we are past COVID-19. Obviously, this is the new normal. There are resources that are available through our office if you need access to legal services. We are very concerned about evictions in New York State, and we're trying to make sure that we put in place laws that will carry out the eviction moratorium to make sure that our communities are not further displaced through COVID-19. But if you do need legal assistance, our office is here to help. If you're a small business, there is also, thanks to the leadership of the Congressman and New York Presbyterian Hospital, a small business grant that exists in our community, as well as additional resources that are coming from the city for winter months. If you are a small business owner who has outdoor dining, you can apply for heating and other help from the city. And we also want to make sure that people know that mental health, and I know that the Councilwoman is the chair of the Mental Health Committee, is always at the forefront of our minds. With all the trauma that has been inflicted in our communities through COVID-19 and not being able to really grieve those that we've lost, mental health should always be at the forefront of healing. And so we also invite you to reach out to our office if you need access to help and to services at this time. Thank you, Congressman.
I know that you have been a real advocate for that, and the Councilwoman is a chair of that committee. So before we leave, could you just share some ideas on what the program that's about to be launched entails for the 13th Congressional District, the mental health program?
Absolutely. Well, with the leadership of the Congressman and New York Presbyterian Hospital, Columbia University, there has been real leadership in creating an initiative that will intervene in moments of crisis for our communities. We have a crisis intervention team that is going to be put on the ground to make sure that our community has access to quality mental health services during this time. But in addition to that, there's also going to be an online program that will also be facilitated through this initiative to ensure that things like, for example, talking about depression, talking with a teenager about suicide or suicide prevention is also something that happens in our communities and will be done virtually as well. So we are excited about the launch of this initiative and ensuring that true access is given for mental health services in minority communities of color.
We will probably be facing a mental health tsunami. People were unable to say goodbye to their loved ones that they lost during the pandemic. People lost their jobs. People saw their businesses shut down. They were quarantined for months with their children at home, facing distance learning and the challenges that presented. So I know that all of this now is sort of like a perfect storm, and we will see a mental health tsunami. What can you share with us, Councilwoman?
So I think that we saw something that was very unique this time. I mean, during this pandemic, is that we saw that virtual telehealth services were actually very successful way of psychiatrists offering, or even counselors of continuing to service their patients. However, there still continues to be, you know, a long wait period for accessing mental health services because we still continue to have a shortage of mental health providers. We have been, you know, really advocating to ensure that those services are available to children in schools because we know that with remote learning, it becomes a little bit more difficult to access those resources. And we have been working also with the administration in trying to figure out some sort of on-site mobile resource that would be available to individuals that may be chronically street homeless right now, that may be suffering from chronic mental illness that's untreated. We acknowledge that during the pandemic, we're seeing more and more people out on the street that appear to be homeless, but our understanding is that the homelessness is really like secondary to the mental health issues that are just being untreated. And I agree with what you're saying. I think that we're going to see, you know, the devastating impact of COVID-19 in the next, you know, couple of years. Like we haven't even started to, you know, to see beyond the surface of what the impact is right now. I think people are trying to survive and people are still in survival mode and have not allowed themselves an opportunity to really grieve and to feel the energy, right, that has been put out into the universe in the last few months. So thank you, Congressman, again, for hosting this really important conversation.
I want to thank both Councilmember Diana Ayala and Assemblywoman Carmen de la Rosa for their input during this NYC Represent feature by Manhattan Neighborhood Network. Thank you so much, everybody, for tuning in to this Manhattan Neighborhood Network event. Again, the COVID-19 pandemic is still very much alive. Wash your hands with hot water. Make sure you use your mask. Make sure that you social distance. The Councilwoman mentioned Halloween. If you're gonna go out with your children, make sure that you social distance and that you will attend only a responsible social distancing event that will adhere to all the regulations, to all the rules that are being pushed by the CDC. If you need a grant or a loan, if you're a small business owner, please also contact Councilmember Diana Ayala, who today unveiled a very, very impressive program that will continue to assist small businesses across the district. Thank you, Manhattan Neighborhood Network, for allowing us this opportunity to communicate with our constituencies. God bless you and keep the faith.